For lumbar spine longitudinals, again, nice technique for patients, can be quite relaxing actually, especially if you've got a lot of tension in there. It can be really nice for easing off some muscle spasms and also causing joint separation, which tends to feel nice regardless of whether you even have a back problem. To perform this, we can either do it bilaterally or unilaterally. If they have bilateral symptoms, you will tend to want to go for a bilateral technique. Unilateral symptoms, you would just do the side that was problematic. Equally, if you have a strength issue for you and what you're trying to perform, then of course you could do a unilateral on both sides for a bilateral problem. So don't ever put yourself at risk, or of course the patient. In performing this technique then, we've got two different positions. If you're working on the lower lumbar spine, then what we're going to be looking to do is to slightly flex the legs, and if we're working on the upper lumbar spine, then we have the legs a little bit more extended. So let's work on the lower lumbar spine to start off with, because the bed is already in an ideal position for me here. So I shall do bilateral. We're going to take hold of the ankles and raise the legs up to around about 30 degrees or so. I'm going to use the bed here with my thigh, because as I pull, what sometimes happens is the bed starts to slide across the floor. Equally, you'll notice I've stripped the bed, taken the couch cover off, because I need them to stick to the bed. Please make sure you clean your bed afterwards. From this position here then, what we're going to do is I'm going to apply a longitudinal pressure going through the legs in this direction. Okay, so I'm going to pull towards me here. So as I pull, I'm then able to push against the bed with my thigh. Some of you may prefer to do it in this way. If you're going to lean back, make sure your other leg is under you to lean back onto. Because if they say it hurts, and you need to therefore ease off, and you're like this, with your legs in front of you, the only way you're going to get the pressure back is to pull on them, which is only going to apply more pressure, and then you're hurting them more. That doesn't make sense. So you have to have your other leg underneath you. They say it hurts, and I can push from the ground up to ease off my pressure. But for me, I quite like to have my thigh against there, so then I can actually pull. And as I pull in here, I'm pulling against my own thigh. So you can either do a sustained pressure, or you can oscillate. And within a range of resistance-free or in resistance that works best for the patient. All of these techniques should be pain-free. Sometimes patients feel a slight almost gathering of pressure as you give them their legs back. Unilaterally, of course, well, just one leg. Makes it easier for you. Less pressure, less force, easier technique slightly to do. And then of course, to adjust to the different area of the spine, I'm going to raise the bed up, so then it makes my job easier. Now I want to go almost straight in line, but not with their legs against the bed. Just in there, in this position here. And then we pull. Of course we can oscillate, or we can sustain. I tend to start with a sustained, and I might move on to oscillating. And we can do unilateral too. Oscillating or sustained. Here we go, longitudinals for lumbar spine.